Hello and welcome to the Actually podcast, where we learn about farming and food from the people who actually grow and process it. I'm your host, Sheridan. Join me as I learn as much as I possibly can about agriculture and food production. Thank you so much for being here. Today I'm joined by Dr. Michelle Shack, also known on Instagram and TikTok as Dairy Doc. She has been a dairy vet for 9 years and has been on social media for 3 years. She's acquired a large following and shares vital information about agriculture, and specifically animal care and the dairy process. Okay, Dr. Michelle, thank you so much for sitting down with me today. I really appreciate it.
Thank you for having me.
Will you please begin by telling us a little bit about your background and how you got started as a vet?
Sure. I grew up in the Bay Area in California. I did not grow up in agriculture at all. And it wasn't until I went to UC Davis that I got exposed to cattle. And I started working with them through my animal science classes, which were prerequisites to get into veterinary school. I knew I wanted to be a veterinarian, but at that time, I got the opportunity to work with a lot of different types of animals. I worked with cattle and sheep and goats. I shadowed a small animal veterinarian and I didn't really like it. And I was really loving what I was doing in all of my classes. So I applied to veterinary school and I went to UC Davis, and I specialized in food animal medicine there, or production animal medicine. And that was what led me to Arizona to join a dairy practice out here.
Very cool. As a vet, your first priority is animal health and wellness, correct?
Yes.
So I'm going to read to you a quote from an animal advocacy website, and I'd like you to respond to it. Quote, "Selective breeding to increase a cow's output of milk has had devastating effects on the cows themselves. Today, a dairy cow can only be kept between 3 and 5 years. After this time, her body becomes so calcium depleted, her feet and legs so weakened, her body so emaciated that it is no longer cost effective to keep her. She becomes what the industry calls a cull or a spent dairy cow." End quote. Is this true or untrue?
I hear this type of comment and these statements a lot online on social media. They circulate. And first of all, I just want to say that I really hate the term spent dairy cow. I don't know how an animal can be spent, but it seems really disrespectful to the animal to use the word spent. So I don't ever use that word. But the question is really, or the comment is really surrounding this 3 to 5 year lifestyle. So let's back it up a little bit. Dairy cattle are raised to produce milk, but they're also raised to produce beef. Beef cattle are raised to produce beef only. So when we think about a beef steer growing up on pasture, raised on a beef ranch that ends up going to slaughter and becomes beef, that process usually takes about 18 months to 2 years. So if the animal is being harvested for meat around 18 months to 2 years, for some reason, nobody calls that animal spent or indicates that that animal is at the end of its life or is so exhausted it can't go on. No, because we want healthy animals in our food supply. So now let's go back to the dairy cow. If she is going to slaughter at 3 years old, 4 years old, 5 years old, that doesn't mean that she's unhealthy. It doesn't mean that she is unable to walk or her body is unable to continue. It just means that she is used for dairy and also beef. There's a variety of reasons dairy cattle are sent to become beef cattle, and some of those depend on the individual producer. So for example, some producers say, I would like to raise my animals up, have them have 3 or 4 babies, and then they will become beef cattle after that. And that's actually a trend that I hear a lot on social media is they shouldn't be having so many babies. So these producers that are only choosing to have the animals breed 3 or 4 times, they're actually doing that, and they're producing milk for that time, and then they're producing beef. Some producers want them to live long lives, and they may live for 12, 13, 14 years. That number is an average. It also takes into account the younger animals that went to slaughter around 18 months and never ever produced milk. So it's an average. It doesn't mean that those animals have poor care. It means that we are trying to send healthy animals into our food supply on the meat side, as well as keep our dairy supply healthy as well. And so there's no reason any animal should be spent, as the idea is claimed. The other thing to think about is these animals, if we did let them live out the length of their lives, because with that comment, I also often hear these cows should live to 20 years old. Well, I've seen a 20-year-old cow in the hospital, and like in the veterinary hospital when I was a student, I've seen cows live to over 20 and they're suffering a lot. Mm-hmm. That's very, very old for a cow. They can live that long. So I want to be very transparent, and I don't think we should negate that fact. They can live that long, but the farmers are raising these animals to stay healthy. And if there's any indication that she is not a good dairy cow, or her well-being is not going to be well cared for as a dairy cow, or she is starting the decline, then she can go to beef. So for example, if a cow has had mastitis for 3 times in a lactation, a lot of producers...
Can we clarify what mastitis is?
Yes, sorry. Mastitis is an inflammation or infection of the mammary gland. People get mastitis, dogs get mastitis, any lactating animal can get mastitis, and many producers will choose, if an animal has repeated mastitis, to no longer milk that cow and instead have her become a beef cow. That doesn't mean that she is unhealthy or her body is giving out. It just means that that is not a good avenue to continue milking this cow for her own well-being. Mm-hmm. So the farmers are making the decisions based on the animals, for what's best for the animals. And though they may not live until 20 years old, that's because we're trying to send healthy animals into the food supply on the meat end. And if you wait until they're 20 years old, they probably have cancer, they probably have heart disease. There's a lot of things that old animals get, and that's not the animal that we want to send into the meat supply. So I think it's good for people to recognize that these animals are for dairy and for beef, and that's not a secret. We're not trying to hide that, but that does play into the choices that we make in agriculture, and it helps influence the time that she will be going to slaughter, and so therefore her lifespan.
Okay, that makes sense. Thank you. I did want to go back a little bit. You said sometimes this average, 3 to 5 years, takes into consideration animals who have not started producing milk who get sent to beef. So yes. In what situation would a young female cow, a heifer, go to beef before she's begun producing milk?
Yeah, so she may be a free martin, and that is an animal that is sterile. We could go into that, but anyway, the point is she doesn't have a fully developed reproductive system, and she can't have a baby, and they have to have a baby in order to start producing milk. She may not be able to get pregnant for some reason or another. Sometimes we see cystic ovaries. Sometimes we see just an inability to get pregnant. Sometimes we see pregnancy loss. So maybe they got pregnant but then lost the baby. Any of those reasons, or there's a variety of other reasons too. Perhaps she has hoof issues, chronic hoof issues, and the farmer's been working with her to keep her feet healthy, but they're unable to. Perhaps she had pneumonia as a calf, and we don't want to put her through the stress of giving birth. There's a lot of different reasons, but most dairy farmers are beef farmers as well, even if they sell the animals for beef or whether they raise them out themselves. And so it is very common that some animals will go sooner than others, and that's part of owning a farm.
Okay, thank you. So when you go to a farm and you do a wellness check, what do you look for? And when you notice an issue, how do you work with the dairymen to resolve those issues?
I love this question because a huge part of what I do is wellness. Just like you said, it's preventative care. I think people imagine veterinarians to be coming in and saving the day of an animal that's dying and we've saved her, or checking in with a big outbreak and making sure that we get the whole herd better. And while those things happen, those are really uncommon. It's much more common. Most of my day is spent doing preventative care, which means working on the animal's health and wellness in order to prevent any problems from occurring. So a wellness check usually depends on the age of the animal, similar to you bringing your dog to the vet. If it's a little puppy, it may have different issues than if it's an older, like a senior wellness check, or kind of a midlife wellness check. The risks are different at different ages. So for example, I may come into a calf barn and look at all the calves, and I can scan the lungs of all of the calves, not just the sick ones, but go through and actually do an ultrasound to look at the lungs and the lung tissue on the inside and see how the health of their lungs. And then I can catch problems before they occur and address those. And on older animals, it often involves reproduction, so pregnancy diagnosis or checkups on their pregnancy. We do a pregnancy exam about once per trimester, and that it involves checking on the health of the cow as well as the calf and making sure that everything is proceeding normally. When I find an issue, how do I work with the farmer is your question. And the farmer, it's in their best interest, and they're very focused on keeping their animals healthy. So a lot of the issues that I see come down to fine-tuning the management. So perhaps we say, you're having some of the cows that recently gave birth are having some health issues. Maybe we need to adjust the ration. Maybe the alfalfa or the whatever is in the ration, maybe those things need to be changed a little bit. Or maybe we need to test the feed and see, because maybe that cutting from the field has a little bit lower protein than normal. Maybe we need to add in some minerals or vitamins, those types of things. So it usually involves fine-tuning the management and making sure that we're addressing the needs of those animals and preventing those problems from occurring.
Okay, so it's kind of like a holistic approach to wellness. Instead of just treating symptoms, like you find a sick cow and you treat those symptoms, you are looking at things before something becomes an issue, right? You're going through the whole, everything involved in the cow. So like their food and their bedding, like where they sleep and all of those kinds of things, right?
Yes, and one of the things that I do quite regularly is evaluations of different parts of the farm. So the farmer will actually pay me to come to the farm and do wellness checks and spend time working with the employees in different parts. So perhaps I spend a few hours working in maternity just with the cows giving birth. And then maybe the next week I might spend a few hours working with the calves. And then another time I may spend some time working with the milking barn and milking procedures. I may spend a few hours looking at lameness. Like all of these things, we can evaluate each aspect of the dairy farm and find small issues that could potentially cause a problem before they're actually causing a problem. And that's one of my favorite parts of the job.
Yeah, I think that sounds really cool. I do agree that a lot of people think it's just you come in to fix a problem, but you are fixing things before they become a problem.
Yeah, I think that's because they are thinking of the model of small animal. So you bring your dog, your cat to the vet if there's a problem, or maybe once a year for vaccines. But what people don't realize is that dairy cattle veterinarians are on the farm once a week or twice a month or once a month, depending on the size of the farm. And so we're here very often looking at all of the animals, and we're able to not only address issues before they come up or make small recommendations, but we're able to follow up on those recommendations. When you bring your dog to the vet and the vet says, put your dog on a diet because it's too fat, and then you go home, the vet might not see you again for a year. And maybe you think it was on a diet, or maybe the diet isn't working, or however that works out for you, but you're not going to get that follow-up for a year. Whereas I am able to be on farm oftentimes once a week or twice a month, and I'm able to follow up on the recommendations that I make and work with the farmer to make sure that they're getting implemented correctly.
A lot of folks are concerned about vaccines, antibiotics, and hormones making their way into our food products like milk and meat. Can you tell me a little bit about how and when these are administered and if they make their way into our food?
Yes. The vaccines that we use and the antibiotics and the hormones, those are all given under veterinary supervision. So just like you may bring your dog to the vet for an ear infection and you get antibiotics and you give that antibiotic for a specific amount of time according to the directions of the veterinarian, same thing on the farm. So they have a specific protocol that they have to follow. And vaccines there's some core vaccines, but then there's also some kind of lifestyle vaccines depending on the farm. So it's not really a one size fits all approach. It depends on the farm which vaccines are given and when, but it's all according to the directions of the veterinarian. Antibiotics have to be given to the animals that actually are sick and have a diagnosis, and they're given to treat that, or to the group if the group is at really high risk. But it's only for a set amount of time. We can't feed antibiotics just for growth promoting reasons. I think a lot of people think that. That's just not true. It's not allowed. And then the hormones also are given for a specific purpose under veterinary supervision. Again, we're not pumping them all full of hormones nonstop. I don't know where that came from, but that's not true also. All of the medicines that we give have what's called a withdrawal period, which means that that's the time that it is cleared from the animal's system. So, for example, did you have strep throat when you were a kid?
I did.
Yeah. So most of us did, and you took antibiotics for it, right? And now you're a full-grown adult, and probably those antibiotics are not still in your system, right? So just because an animal receives antibiotics, it doesn't mean that the products that come from that animal are tainted for the rest of her life. There's a specific amount of time that it takes to clear those antibiotics from her system. That's called the withdrawal period. That period has to be followed legally. And every tank of milk is tested to ensure that there are no residues in that milk that is contaminating the milk. So yes, vaccines, antibiotics, and hormones can be used in a conventional farm. There's different rules for organic, but on a conventional farm, yes, those things can be used, but they have to be according to the veterinary prescription, according to the protocol, and the withdrawal period has to be followed. So during that time, for example, for a milking cow, during that withdrawal time, the cow is still milked because she's still producing milk. So we still milk the cow, but then that milk is dumped down the drain and is illegal to put it into human consumption if you have not followed the withdrawal period. So most dairy farms have a hospital area or a hospital pen for any sick animal or animal receiving treatment. And all of those cows are milked together, and then that milk is discarded. That keeps our food supply safe, and as a veterinarian, that's a big part of my job, is the safety of our milk supply and our meat supply. And it's really important for the consumer to understand that that is a big part of what we do, and that people are keeping a close eye on it, and that your milk is safe.
So one of the bigger complaints about dairy farming is the separation of cows and calves. What can you tell me about this practice?
This is a hot topic right now, and I get asked about it a lot on social media. And actually, it's a hot topic in the industry in general. I'm going to the American Association of Bovine Practitioners conference, which is the big conference for bovine veterinarians in the United States. And there's a whole talk about cow-calf contact, cow-calf separation. And so I'm excited to see what I learned there. But I will say it's a renewed area of research. Let's take a step back a little bit. As I started getting these questions, I started looking back, and I can find recommendations from industry experts, university type people, as far back as 1806, recommending that we separate the cows and the calves. Now, during that time, we didn't have antibiotics. We didn't understand hygiene, and it was recommended for the health of the animals to separate them. So over time, that became common practice. Our farms were built to house cows and house calves, and not built for them to be together. So that's generations and generations and generations of farm families.
So when people say, like, why don't we do it like Grandpa did it? This is how Grandpa did it, right?
This is how Grandpa did it, yeah. And the farmers are just doing what they know best. They know how to do this. Their facilities are set up correctly for it. And they're doing what they know best, how to take care of their animals. And let's also really stop and think about it. All young stock are separated from their mothers. Beef cattle are, dogs are, cats are. This is how we keep domesticated animals, and that's really common. Does that make it right? No, it doesn't. Does it make it wrong? No, it doesn't. We are still learning more and more about this topic. So as we've learned so much about hygiene, and now we have antibiotics, we have vaccines, we have so much more technology and so much more understanding of how to care for the cows and the calves. And so the industry is starting to shift. How will it shift? I don't know. It's evolving research, but there is a bigger focus on the well-being of the animals now, understanding the social and emotional well-being. So for example, one practice that's growing in popularity right now is social housing of calves. So keeping calves with other calves. And they've actually done a bunch of research around this topic and shows that that is able to fulfill their social needs, keeping them with other calves. That is very new and is just starting to be adopted within the industry. But what I will say is farmers will follow the science. The farmers care about their animals and they are trying to do what's best. There's just not a lot of research out there about cows and calves and separating them or keeping them together. And so that research is ongoing, and it will be interesting to see what we find out. I know that I work with my clients in the constraints of their facilities, because the way the facilities are built, it's not really safe to keep the cows and the calves together the way most dairy farms are built. So I work a lot with my clients and with farmers to make sure that the cows are well taken care of and the calves are well taken care of. There are some countries in this world that have instituted a requirement that cows and calves have to be together for a certain amount of time before they're separated. That has its pros and cons. I know that I work with beef cattle farmers or ranchers, and if they leave the calves with the cows for longer periods of time, months and months, and then they separate them, that separation is hugely, hugely stressful. The longer the cows and the calves are together, that bond is solidified even more, and it becomes more stressful. Dairy farmers choose to separate them usually on the first day, sometime within that first day. It's still really important that the calves receive the colostrum, the first milk from the cow, but they're often separated. Again, is that the best thing to do? That's the best thing that we know how to do right now. There is a lot of research going on, and I'm excited to see where the industry will go. I think it's shifting and changing, and our tools and abilities and understanding is shifting, as well as our focus on social and emotional well-being, and I think that's really important. So I don't have a very clear answer for you, but I think it's important that we're entirely honest about it, and all the farmers that I know work really closely with the veterinarians and are following the science of what's best for their animals.
You said that we generally separate them to keep, or for safety reasons. Is this for safety of the calf or safety of the cow?
Well, the research is still working on that. I think originally it was for the safety of the calf, but somewhat the safety of the cow as well. So the calf would nurse and would spread bacteria and could give the cows mastitis. The calves aren't able to, they have a very naive immune system, so they aren't able to protect themselves from some of the common pathogens that are in the environment or that the cow may carry. The facilities are built out, so the beds are built for the cow to fit a cow. The water troughs are tall, so the cow can drink out of them. The feed bunk is where the cow can eat it. and the calves don't necessarily have the ability to utilize all those things in the same way. So I think that now we're still learning about the spread of disease, and if you keep cows and calves together. Some of this research they're doing, they're looking at what if the cows and the calves have sort of like a visitation where they just get to be together for a certain amount of time. What if they have nose-to-nose contact through a fence line, but the calf can't actually nurse? There's a lot of different ideas out there, and we're exploring them all, and it's really cool, I think, to see how all of these things are coming about, and all of these ideas and what we're looking into. But I think what we can say for sure to the consumer is that the industry is trying its best to do what's best for the animals, but we're still learning what that is. And it may seem that keeping a cow and a calf together is the best, but it's not always the best. Even beef cows, sometimes they are separated and the calves are bottle fed. There's a lot of reasons to bottle feed a calf. And so I think it's important to understand that our idea of what is best is not always. And so that research is really important to back up our decision making.
Yeah, I think another thing too, growing up on a dairy farm, I would see this. Some cows just don't make good mothers. They just aren't caring, and they'll neglect the calf right away, or they're just too rough with the calf. And so, I don't know, I think that's another thing that people don't always think about, is the fact that it's still an animal. And I don't know, I just think that sometimes cows are not what we expect them to be.
Yes, we imagine this world where everything is natural, and so the cows and the calves can stay together. But when we say natural, nature is cruel. Out in the wild, babies get abandoned by their mothers and they die. And here on the farm, these animals are domesticated and we have a responsibility to care for them. That being said, I see a lot of people just say cows are bad mothers, full stop, end of story. Yeah. And I don't think that that's right either. Yeah. So I want to be very clear that there are some cows that are bad mothers. I agree with you, but some are not. We don't actually really know because we've been separating them for so long.
True.
We have not bred the mothering instinct into them. So like beef cattle, if she's a bad mom, she doesn't stay in the herd typically. And if she's a really good mom, then she stays in the herd. And we can actually genetically look at that behavior and choose animals that will be good moms. That trait is not looked at in dairy cattle at all. So there's going to be some that are really terrible mothers. There's going to be some that are really good mothers. And so I think that issue gets polarized a lot, because the activists will say, no, you can see she wants her baby in this video. And then a farmer will say, you can see she's trying to kill her baby in this video. And I think we need to remember that cows are individual beings, and some of them will be good and some of them will be bad. And so there's not one right way to do things. And so we're still trying to figure out what the best move forward for the industry is. But there's a lot of regulatory programs and animal welfare programs that help standardize the industry and help move the industry forward and move the farmers to do what's best for the animals.
Yeah, that makes sense. I never thought about breeding them for motherly instinct. That's actually really cool.
Yeah.
So our last question, it's kind of a big one, so you can narrow it down if you want, or you can make it really broad. But what would you say is the biggest misconception about dairy farming?
I think that there's a few things that kind of relate together, but I think a common thing that I see is that there's some big bad dairy industry that is doing bad things. I'm not really sure what people think, but when we talk about the industry, what we're talking about is individual farm families. Like, you have a farm and I have a farm and we work together because we're in the same area, and now we make up this area's dairy industry. That doesn't mean that it's some big bad corporation or whatever people think. It means that there's just a collection of people that are trying really hard to care for the animals, and that's the industry. Mm-hmm. I think the other thing that I would like to touch on again is that these are individual people trying to do the best for their animals. So a lot of times when an animal abuse video comes out, for example, some of those are absolutely horrifying. There's no excuse for what is being shown on some of those videos. But the videos and the media make it seem like the farmer wanted that to happen. And so, like, do you have a dog?
Yes.
Okay, so imagine you hire someone to be your dog walker, right? And they come from a good company, and they come in and they walk your dog and everything's great, and then 6 months later you find out that they were abusing your dog while you weren't there. Well, you would be horrified,
For sure.
right?
Yeah.
That would be awful and inexcusable. But that doesn't make you a bad owner. That makes that person that was doing those actions a bad person. Mm-hmm. And so I think that it's important for people to understand that there's a lot of people working with these animals, and how the animals are cared for, in my experience, depends on the values and the priorities of the owner. But even so, sometimes things happen and it's inexcusable. It should never happen, but it doesn't reflect the values of that farmer, and it doesn't reflect the values of the industry as a whole. If one bad thing happens, that doesn't mean that every farm in America is doing these things. And then I guess my third point on this same topic is that every farm really is different. So just like if you have a farm and I have a farm, we may do things a little bit different. Or you have a dog and I have a dog. Your dog might spend more time outside and my dog might go on more walks. And there's different ways to care for animals, but it doesn't mean one is better than the other. So these are individual families. And though there are welfare programs that try to make sure that the bases are covered and the welfare is standardized to a point, whether you keep your cows in free stalls, or I keep my cows in a dry lot, or our neighbor keeps their cows on pasture, those things are going to be individual to that individual farmer, and it doesn't mean that one is better than the other. And sometimes it really depends on the region and the resources available to them. So I guess that would be my biggest thing, this misconception that I see, is that we seem to have forgotten that these are real people caring for the animals, and this is real farm families that are just individuals trying their best to do the best for their animals. And there is not some sort of big bad mega corporation that's controlling all farms in America or something. I don't really know what people think, but it seems that way when I talk to them, that they've forgotten that these are real people. And the farmers that I work with are real people, and they're really nice people. And they're just trying the best that they can to do the best for their animals. And that's really important. To me, that says a lot about how cows are cared for. And I think that if the consumer, if you ever have a chance to meet a farmer, you should take that chance. Take a farm tour. Go visit your local farms. Ask them these questions. They're legitimate questions, and you should know. And
another thing, farmers love to talk.
They
will talk to you. They will answer any question you have, even if you think it's stupid.
Yes. So learn from them and see what goes on, and then make your own ethical choices. And don't just listen to whoever's talking to you online. I mean, I even say that on my videos online. I say, this is one example, but you should go visit your local farm and talk to your local farmer, and then make your own choice about it, because these are important topics and they do affect our lives. They affect the farmers' lives. They affect the consumers' lives, and you should be educated about them. And I think that that's great. And you have a chance to from a real farmer. And so that's a pretty cool opportunity if you can find it. Yeah,
for sure. Well, thank you so much for coming on today. I really appreciate it. I learned a lot. I was so excited because growing up on a farm, and a dairy farm specifically, I know a little bit, but not a ton. And so I was really excited to sit down and talk more.
Yes.
I really appreciate it.
Good.
So follow Dr. Michelle on Facebook, Instagram, and TikTok,
yes.
right? I'll include her the name in the show notes, like in the description. That's all. Thank you.
Thank you so much
For joining me on this journey as I learn what it actually takes to grow and process our food. I hope you learned something new and interesting in today's episode. If there's a process that you'd like to know more about or any questions that you may have, please leave them in the comments. Next time you eat something, remember to thank God and thank a farmer.